Hi everyone, I'm Dr. Karishma, plastic surgeon at Dr. Karishma Aesthetics. Today I'm going to take you through a procedure called as the direct brow lift. Now this lady came to me with the concern of having drooping eyebrows. She was concerned that her eyebrows are too flat in shape. Now, as we know, most women like to have an arched eyebrow, and that is what is in vogue and in trend these days and always has been. For men, usually the eyebrows can be a little more straight, whereas in women, they like a peak of the eyebrows and a more arched eyebrows. Now, this patient has already undergone an eyelid surgery, blepharoplasty, and she's removed excess skin on her upper eyelid. So this patient was still not satisfied with the result of blepharoplasty. Even though her eyelid was fine, she still felt that there was a little drooping on the side of her eyebrows. So we plan to do a direct brow lift. Now there are various options that you have to do an eyebrow lift. The simplest option is doing a non-surgical eyebrow lift with Botox. What we do with Botox is we paralyze the midline muscles of the forehead and leave the muscles on the side of the eyebrow. So when we relax the muscles in the midline, the muscles which start getting overactive in the side of the eyebrows and help to lift the eyebrows, and that gives you a non-surgical, very simple eyebrow using very few units of Botox. The next level after this, if a person is not happy, we can do an endoscopic brow lift, is where we make a tiny cut into the hairline. We pass a scope which has a lighted scope, and with the scope we help to lift the eyebrow from within and fix it onto your scalp with fine sutures, and also sometimes using certain small pins. Well, if a person does not want this treatment, then the final treatment is a direct brow lift. Now, direct brow lift has to be chosen, and this particular patient being a Caucasian skin, a whiter skin, the scars heal much better than an Indian skin. We went ahead and did a direct brow lift, and now if you can see this procedure, we started by doing certain markings. These markings are always done pre-procedure with the patient in a standing position, and we decide how much of lift of eyebrow the patient wants. We also have to be very careful and measure out to see the distance between her eyebrow and her forehead hairline, and the distance between the lower part of the eyebrow and the upper eyelid. We need to make sure that when we lift the eyebrow, she's able to close her eyes, and that's why these markings are so essential before the procedure in the standing position. Then we take her in for the procedure and we make the cuts along the pre-procedure markings that we have done, and we only remove a strip of skin, and then we undermine an area below the eyebrow and lift the eyebrow up and stitch it to a new position. Usually it is about 7 millimeters to 10 millimeters of eyebrow height increase. At the same time, we have to make sure that her upper eyelid is closed and her eyes are not opening, because that will indicate that we are removing too much of skin. So a direct brow lift is usually a final permanent procedure for a patient who wants to have a permanent eyebrow lift. For a period of time, the eyebrow will remain static and there may not be too much of movements with facial expressions, but over 2 to 3 months time, once the stitches heal and the scar heals, then the movement of the eyebrow will reinitiate in dynamic movements. So for more such procedures and various plastic surgical videos, educative videos about various cosmetic surgeries, please do follow our YouTube channel Dr. Karishma Aesthetics. You can also follow us on our Instagram handle Dr. Karishma_aesthetics. Thank you so much for watching. Don't forget to press the bell icon and keep your comments, and we would like to answer your comments. Please like our videos. Watch out for more videos in the future.